Hey everybody, good morning. My name is Jordan Smith. I'm one of the residents at the University of Florida Department of Urology. I just started my second year about a week ago, and we'll just be kind of taking you guys a little bit through my day as a junior resident and what that looks like here at the University of Florida. To begin, as you kind of saw on the alarm clock, it's about 5:30. And that's when my day typically begins. I would say on average, that's probably a little bit later than I normally wake up. There were plenty of days intern year where rounds actually started at 5:30, which required me to get up significantly earlier. About halfway through my intern year, I sort of realized that the best time for me to go ahead and be able to work out routinely and consistently is to actually do it before work in the morning. So that's kind of how I start my days. I go ahead and use my home gym to work out. So as you can see, today was arm day. I normally work out somewhere just between 20 and 30 minutes, which seems quick, but it allows me to just get it done in the beginning of the day, and it's just a good way to start my day. So after I wrap up with that, I normally go and rinse off and get dressed and go make a cup of coffee and pack my lunch and get ready to head to the hospital. Alrighty, so I have arrived at the hospital a lot later than normal. It's a little bit before 7 o'clock. We have a conference this morning at 7 o'clock, a welcome breakfast with our program director. I would say that it's very rare for me to be getting here when it's already daylight. About 90% of the time, I'm walking into the hospital in the dark for sure. And the reason that I'm here a little bit later today is that our current inpatient team does not have any inpatients. So here at the University of Florida, we have a mentorship model. So as opposed to being one inpatient team that we round on every morning as far as all the patients, I'm currently on our reconstructive team, which means that we have 3 attendings that are sort of considered our male and female recon and men's health team. And so when those attendings have inpatients, those are the ones that my chief and I round on. So nobody inpatient today, which means that we don't have to round. So I'm gonna try to talk and walk here a little bit as I'm walking in, but as far as one of the great things about Gainesville is that it is a smaller town, and so my husband and I were able to buy a house, and my commute to the hospital is probably about 12 minutes, even around 7 o'clock. So that's really nice. It's very easy to live here, very easy to get to the hospital. I would say that we have a parking garage that it's about a 10-minute walk from the parking garage to the hospital. And I'll go ahead and show you guys because I think it's really great. Another benefit about Gainesville and the University of Florida is that it actually, all of our buildings, our important buildings, are very close together and in walking distance. So hold on one sec. So as you can see, it's a beautiful Gainesville morning, but so that building right in front of us is actually our North Tower and our Children's Hospital. The building that I'm focused on in the center now is our Heart and Vascular Neuro Hospital, and also our Cancer Center, which includes most of the ORs that the urology operates in. And then you can actually see our VA right there. So all from the parking garage, which is really nice. All right, so this is our resident room. There were a bunch of residents in here that just went out to conference, but so lots of good space, lots of good computers to work on. And we definitely use this space before conference and before North Tower. Or when we're operating North Tower.
I don't know, man.
Nope, so we got some Panera today by Dr. Moy. This is Trish, one of my great co-residents, and Dr. Wiseman over here, one of our other residents, going into the Panera bag of goodness. So this is our conference room. And there's our fearless leader, our program director. So we got a little team breakfast this morning. Hey, we all wave for the camera. Everybody say hi. Great. Everybody say hi. Junior residents in the house. Hello. Yep, and this is just a little post-coffee socializing in our conference room. This never happens, but it's nice. All right, so conference is all done. As far as our normal conference schedule here at Florida, we normally have conferences on Tuesday and Wednesday from 7 to 8 before our cases start. We'll have like a core lecture, AUA curriculum style lecture, and we'll also normally have a grand rounds on Wednesday. So now that I'm done with conference, OR start is 8. So I'm actually gonna run across the street to our main surgical tower and go ahead and get patients pre-oped and ready for the OR. So all of our conferences are in the North Tower, which nicely has a food court with Wendy's and Subway. There's also a Chick-fil-A and a Starbucks in the back. And there's a main cafeteria as well. And it's just opened. So like I said, everything's very close. So you just go out of the hospital and I will run across the street to the other tower. Alrighty, here we are in the pre-op area, getting ready to go to the OR. It's got me and my chief hero over here, and then we have our consult resident, Austin, is down there as well. So just rolling deep for the urology squad here in the surgeon's lounge. Alrighty, patients in the room, robotic sacrocolpopexy, here we go.
PGY2 operating on the robot.
Alrighty, first case done of the day. Just did a little bit of post-op, put in some discharge instructions, got the next patient all teed up. Got to do a little suturing on the sacrocolpopexy, so that was really fun. Also, wanted to show you key thing about coming to the University of Florida. So this is the surgeon's lounge fridge. Behold all the Gatorade. If you come here, you will get tons and tons of free complimentary Gatorade. So Hero told me that I had to show you about some of the other fun perks and free food in the surgery lounge, so hold on for that. All the drawer snacks. We have Rice Krispie treats, hot chocolate, all sorts of nuts. And we also, ice cream. We have free ice cream all the time. I think the strawberry is for sure the best. All right, so ran up to go ahead and get my loops for the open radical cystectomy, hysterectomy, and ileal conduit creation. So that'll be the next case, so off to that. Alrighty, busy day of cases done, and I'm just here with the urology crew hanging out in the surgeon's lounge after everybody is done seeing patients. It was a good day. So it's about 6:30 and I am headed out to my car, just leaving the hospital. I would say 6:30 is a pretty typical time. What's nice here in the summer is that it's still, the sun is shining very brightly outside. The Florida weather is wonderful, although this time of year it is quite hot indeed. Alrighty, so it's about 8 o'clock and I just walked into the house after having some dinner with friends, which was super great. And I get to come home to the cutest little Portuguese water dog named Jefferson. Say hi, buddy. Hello. And we got a little bit of summer daylight left, so my husband and I are gonna go ahead and just take him for a quick walk. So to kind of wrap up the day, I just finished a nice walk that of course was pretty hot and humid because it is Florida in the summer. There were a few things that I was just asked to speak about in regards to the program and why I think it's special and why I think it's a great place to train. First and foremost, I think one of the most unique things about our program is definitely the mentorship model. And what that means is that we actually rotate on teams based on subspecialty of urology. So when you're on urology, you're either on the stone team, the recon team, the oncology team, the minimally invasive team, the pediatric team. There are multiple advantages to this. And I think the most notable ones are the mentorship specifically that's crafted not only between you and a select group of attendings. You get a lot of extensive one-on-one time in the operating room with them day after day, week after week, in order to learn their specific techniques and tips and tricks. But you also get to work very closely alongside another co-resident. So we have normally one chief and one junior on a service at a time. And so you also get their mentorship as well as a junior, which I've just really thoroughly enjoyed when I've had the chance to work with some of our chief residents. Secondly, I think it really helps you to learn urology sort of in chunks. And so you're able to learn different subspecialties and subcategories of urology from the pre-op to the post-op to the intra-op period, and to really get a holistic view, a comprehensive look into each of the different areas of urology, which I think is really helpful and really unique. And I think what allows us to do the mentorship model so well is because we have so many fellowship trained faculty, and we actually have all of the urology subspecialties represented on staff here. And so I think that that breadth of experience and knowledge and diversity of training really allows us to do the mentorship model really well, which I think is a really unique feature of this program. In regards to just quality of life of residency in Gainesville, it's excellent. Our residents are really fun to be around with and enjoy hanging out with each other. I think, post-COVID, it's sort of a new world, but I'm really happy to say that our program, I think, has recovered and gradually incorporated more social activities and made an effort to sort of reinstate some of the traditions that were maybe dismissed during the pandemic. So I'm really excited for the future and think that our social atmosphere here is going to even get better. I definitely feel supported by all my co-residents. All of the chief residents of last year and this year are wonderful. They're so supportive. I 100% feel like they're people I can go to with any kind of question and to get both personal and professional advice. And they're just people that I respect tremendously. So I think that our program is very supportive, very collaborative, and a lot of fun. And also just we have such a diversity of people in our program. We have, residents from all over the country, both in the Midwest and the West Coast and parts of Florida. We also have just people of all different backgrounds and went to different undergrad institutions. And so you really get a nice different group of people, and really, truly, a group of people that really never would have been assembled or had any chance to meet otherwise. And so I think that's what makes it really special. And I know I'm really grateful for all the relationships with my co-residents and my attendings that I've made so far. And, I'd love to meet new people. And we're excited for our current new interns and the new interns that will be joining us next year. And so we hope that you strongly consider coming and joining us down in Gainesville. Go Gators.